Hello viewers, welcome to our channel JD Pharmacoveda. In this pharmacology classification section, let's continue the drugs from autocoids, 5-HT antagonist and the drugs used for the treatment of migraine and also the prostaglandins. So first of all, the 5-HT antagonist or 5-hydroxytryptamine or serotonin. So the drugs are divided into three categories. So first, non-selective antagonist and partial agonist or antagonist. So the drugs are ergotamine, lysergic acid diethylamide, that is LSD, next 2-bromo-LSD, methysergide, cyproheptadine, cinnarizine. Then the next category is 5-HT2 antagonist, which is selectively act on the 5-HT2 receptors. Ketanserin, ritenserin, clozapine, risperidone. Then the last category is 5-HT3 antagonist, which blocks the 5-HT3 subtype receptors. The drugs are ondansetron, granisetron, tropisetron, palanosetron, ramosetron. So we know that these drugs are very important for the antiemetic action, which is the emesis is induced by the anti-cancer drugs or the chemotherapy induced emesis. Next, the drugs which are used for the treatment of migraine. So migraine is a severe headache that causes throbbing, pulsing head pain on one side of the head. So the blood vessel has the specific receptors like 5-HT1B or 1D receptors in that. So in some peoples, when the serotonin levels are very low and the migraine is induced or migraine is occurs. So we have to increase the level of serotonin. So here the drugs act as one for to treat attacks and one for to prevent attacks. So the first category is to treat attacks. So first, simple analgesic drugs like paracetamol, aspirin, metamizole and codeine. The next category is non-steroidal anti-inflammatory drugs like ibuprofen, naproxen, diclofenac and mefenamic acid. Then the antiemetic drugs are metoclopramide, domperidone, prochlorperazine, promethazine. Then the next category is ergot alkaloid. The drugs are ergotamine, dihydroergotamine. Then the next or the important category is selective 5-HT1D or 1B agonist. So the drugs are sumatriptan, risatriptan, naratriptan, solmitriptan, foravatriptan. So these triptans can constrict the dilated cerebral blood vessels in the brain and also inhibit the release of vasoactive neuropeptides by trigeminal nerves. Then the other category is to prevent attacks. So the drugs are propranolol and other beta blockers, amitriptyline and other tricyclic antidepressants, flunarizine, valproic acid, gabapentin, topiramate and cyproheptadine. Then the other autocoid is prostaglandin. So prostaglandins are hormone-like substances that regulate many bodily functions. They are produced by the body in response to tissue damage or infection. So they are very important for normal bodily processes such as blood flow, inflammation and menstruation. So the drugs are natural prostaglandins are dinoprostone, that is PGE2, gemiprost, dinoprost, PGF2 alpha, alprostadil, PGE1, prostacyclin, PGI2 or epoprostenol. And the prostaglandin analogs like carboprost, the chemical is 15-methyl PGF2 alpha, misoprostol means methyl PGE1 ester, lanatoprost means PGE2 analog, travoprost, bimatoprost. So here in this classification, the question may be asked like the carboprost is given and the chemical name is asked. So make aware of that. Thank you for watching. If you like our video, please like, enter your thoughts in our comment section, share with your friends and subscribe to our channel.